Sal?
Colleagues, thank you. I have two related aspects to my report this evening. The first relates to my role on the Council of Governments and some possible changes that are coming to our regional continuum of care, which is the regional group through which the federal government distributes its funds for housing and human services. Yamhill County is currently part of the rural Oregon continuum of care, which is along with the 27 of our state's small counties. And this makes it difficult to get projects funded in this part of the valley since we're competing with those counties in southern Oregon and eastern Oregon for federal funding dollars. Those counties tend to band together in southern and eastern Oregon for project funding, and it makes it harder for us to get projects started here in this region. So Marion and Polk County are proposing to set up a new tri-county continuum of care along with Yamhill County. That would ensure that we're not competing with those other regions for federal dollars, and it'll make it easier for our tri-county region to start getting coordination and project funding for regional housing and homelessness needs. To the point about Marsh Lane as it relates to this, in our continuum of care in terms of federal dollars, we get about $500 per person for the category of folks on Marsh Lane. That money goes to the county, not to the city. So changing this continuum of care would dramatically increase the resources that are available to local governments in this area to deal with the problem. I think it makes sense for our region to do this, and I recommend that we sign as a city a letter of support in favor of the effort. I'd also like to take a couple of minutes to talk about the issue of homelessness in our community. First, I'd just like to say to people who have come here and given their testimony, we on the council are as impacted by this as you are. My daughter goes to the same library that your kids go to. My daughter can't go to the same parks that your kids can't go to. We have needles in front of my house too. We're downtown. We experience this as much as anybody. It's heartbreaking, it's angering, it's maddening. We are so frustrated on this council with the degree of the problem that has descended on this city and on this region. To say that anybody on this council wants what is happening is just false. But we're limited in terms of what we can do about that. But I would like to talk a little bit about what I think we can do going forward. So as we've discussed in this council, Oregon now leads the nation in unsheltered homelessness. 3 years ago, we were number 4. 2 years ago, we were number 2. And now we're number 1. It's about the only thing I can think of that our state leads the country in right now. So we've been dealing with this on the council for 3 years at least, 4 years before I came on the council. Our city's been trying to manage the growing problem of RV and tent camping within city limits for a long time while this problem has been growing. Prior to me joining the council, our city lost an enforcement action against RV camping. That was before the Boise decision. That was in our local courts that we lost that attempted enforcement action. So the regulatory framework is hard. It's not easy. We have to respect the constitutional rights of people. The stuff that folks see as trash are other people's possessions. If we were to seize that, we would have to do something with it, keep it for a period of time. That costs money. Return it to them after they get done with their criminal proceedings. It's complicated. It's expensive. On the public safety side, we've increased the number of patrol officers in the city. We've assigned a mental health crisis intervention officer to help address this growing issue. In 2008, we spent considerable time and resources in changing city codes to clean up the parking garage downtown. We have started a park ranger program to help deal with the park situation in the downtown core. We've also taken action to ban camping in the public right-of-way and on sidewalks and in streets, but our ability to enforce those laws against camping and human activity that comes with it, human activity being defecating, eating, all those things that we see, that we don't want to see on our public streets. It's limited, severely restricted by the Ninth Circuit Court of Appeals, and then reaffirmed just this month by the Ninth Circuit. And we're limited by our lack of shelter capacity as a community. If we had more shelter capacity as a community, we could do more to enforce the laws that we have. So those of us who want to test the decision will do well to remember that we did lose an enforcement action against RV camping shortly before I came on the council. We rewrote the ordinance so that to make it more enforceable right before the Ninth Circuit came down with that decision. It essentially shot down those ordinances in every town that doesn't have a low barrier shelter. So now we have a bona fide emergency. The term you used, ma'am, is the correct one. We have a health crisis on Marsh Lane. So with summer approaching, I've spent the last few months to reach out to other jurisdictions to learn how they're dealing with how homelessness is affecting their city. We're not the only ones, folks. Our rural region in Oregon is #1 in the country for any rural area for unsheltered homelessness. #1 in our rural area, in addition to being #1 as a state. So this is not just a Portland problem. So the first thing I believe, after talking to the mayor of Corvallis, is that I believe we can enforce our restrictions on camping in the city if we establish time and place restrictions on camping and differentiate between camping and sleeping, as the gentleman who was here suggested. Good idea. Sleeping in the public right-of-way. Especially in the downtown core and in residential neighborhoods, because I think that's what we need to prioritize in terms of public safety. I think it's essential that we take that step to make that differentiation so we can enforce those laws in the downtown core. Second, as I mentioned, I think that the camping on Marsh Lane constitutes a true public health emergency. Today is better than it was during the worst of the flare-ups. I think, Scott, you'd admit that it got up to 79 after the cold weather shelters let out. That's where they went, to Marsh Lane. A bunch of people came out of the cold weather shelters. When the county took action in Carlton, on the private land in Carlton where all those people were camping, where do you think they went? Marsh Lane. So that's why we had the flare-up. And it spread out onto Riverside Drive. I saw it. It wasn't safe to drive through there. It was a huge mess. Well, Riverside is better. Marsh Lane is still awful, at least today when I drove through. Oh, okay. Okay. So it's a crisis. I agree with you, it's a crisis. It's a crisis. And I think our city does not have the resources to deal with the public. Let me just finish speaking, sir. So from a policy standpoint, I think we need more expertise and resources than we have locally available to deal with the issue. And because that's the case, I think we need to give serious consideration, Mayor, to declaring a public health emergency and using the statutory provisions that are associated with that declaration to request specific assistance from both the county, which is the primary seat of the financial resources that could come to us, and the state. Declaring a public health emergency would allow our city to engage in appropriations outside of the immediate budget process, initiate mutual aid and other cooperation agreements to accept resources from individuals and organizations, and crucially set the stage for our city to request state and federal assistance to augment our local capacity. One immediate effect is the director of our local housing authority, Massey Casper, has said that he can use that type of declaration to give him the leverage that he needs to get grant funding for a 3 to 5 year period for a staff position for a homelessness and housing ombudsman coordinator. That was discussed in Remy's committee a couple of days ago. The statute also specifically authorizes the government to provide emergency housing and medical treatment and take other necessary steps to protect public health and safety. This idea originated from my review of the emergency declaration that was made by several Eastern Oregon counties and other jurisdictions to free up state funds to help them deal with the influx of campers during the lunar eclipse a few years ago. It's my belief that if we could use an emergency declaration to deal with a tourism emergency, we can do that for a housing emergency, homelessness emergency. And I've been in contact with policymakers in Newburgh, Redmond, and other cities, as well as people with expertise in both homelessness and this kind of health emergency. And I think that a well-thought-out declaration and request for assistance could cause other cities to join in and could be used to request additional assistance from the state. So I think that's one thing that I think we should give serious consideration to. It's a very significant step. It's not something we should take lightly. It's something that we need to do a very good job of detailing our case for resources. But I think we should seriously consider it. The last thing I want to say is I'd like to take a moment to recognize with appreciation Carl Peters, the CEO of Recology, in appreciation of how he and his company have stepped forward to help deal with the public health crisis on Marsh Lane. They've provided, most recently, solid waste disposal services. They've done that on multiple occasions to help us deal with that, and I just want to make it part of the record how much I appreciate his willingness and his company's willingness to step forward and be part of the solution. So that's my report. Thank you.
Thank you, Sal.